Hi everyone. Jeremy, could you just say like a couple of words about yourself, how like you got passionate about it, and the idea to found a dental wellness?
Yeah, absolutely. I'm a dentist and a scientist, and when I say I'm a scientist, I'm as trained in science as in dentistry, and I've spent an equal amount of time in both. So I was at the UCSF School of Medicine doing research, trying to find a drug to treat or prevent cavities for quite a few years. And along that path, I found a lot of information. Um, I would say the biggest discovery really was that nutrients that are naturally in the food that our grandparents and their grandparents ate are the best things to prevent cavities. When you're looking for something specific and something else keeps coming and keeps coming, it kind of makes you take a step back and think. I've been doing clinical dentistry since I was, 17. I was a dental assistant, and I've been in it the whole time. But I've also been doing research, and so we've come a long way with the discoveries that we've made. And basically, I reached a point where we made the scientific discoveries. We found things that had been forgotten. We brought things forward into clinical care. It made a huge difference for a lot of people who have really been left out of society or kept out of society. Then we marched all these things through new medicines through to the American Dental Association and had them put it in their guidelines, and the World Health Organization, and had them put these things in their lists of essential medicines. And then I worked with the insurance companies to help them figure out what these were, create procedure codes, and start paying for these things, these medicines to treat cavities and gum disease. And then I got to a point where I said, you know what? I think it's time to bring this back to the community that I came from. What's keeping this from being offered by dentists that I would go to or that my friends go to? I thought, I think the final stage in this is bringing these medicines and a type of care that recognizes that we don't need to remove tooth structure to heal and thrive anymore. We don't. Maybe the little case here, you had an old filling, it broke, or crown, a little bit, 5% of problems. And I thought, the biggest barrier why people aren't offering this is nobody's shown that it can be done in, the middle of San Francisco or the middle of New York City, and that people actually don't want needles and drills. They don't want to get all sorts of invasive stuff done, unless they really do, unless they really want veneers, then they would go to. But they don't want to be sold on it. They want to have a basic primary dental health care that can optimize your health for long term, for longevity. And then if they want to get extra beautiful and they can get veneers or whatever, then they can go to a super specialist for that. So that's sort of been my journey. So I'm Jeremy Horst Keeper, DDS PhD. I was trained as a pediatric dentist and as a biochemist, and now I'm here bringing this type of care back to everybody.
Thank you so much. Well, today we will be talking about longevity and oral health as well, which like the main topic of our podcast. And so there is like a growing research that is connecting like oral health and overall health and longevity. So could you like elaborate on how issues like gum disease or cavities might impact a personal like long-term health or age process?
Yeah, absolutely. Being a dentist scientist has put me in some funny places where there's, all the dentist scientists of the world or the country get together. And for years, people were talking about this oral systemic connection. I kind of said, it is important to focus people who have oral diseases on the rest of the body, and people who have diabetes and other diseases on their oral health. But I kept seeing that the data, the analyses, the epidemiology was suggesting that the same people get the same diseases for the same reasons. They have an inflammatory diet, which we understand a lot about now. They don't take care of themselves. They don't exercise, these things. And so I kind of waved it off for a long time, saying, oh, there's not really a connection. It must just be, the same people having the same problem, the same set of problems for the same reasons. And I got proven wrong. Then we started to see data come out on pregnancy. on women who had really high risk, where they were unhealthy. They were unhealthy, generally unhealthy. This is, it would be no surprise if someone walked into the room saying, well, you're sick. You maybe have diabetes already. You're morbidly obese. You have stuff going on.
Mm-hmm.
But you take two of those women, and for one of them, when they get pregnant, during their pregnancy, you clean their teeth regularly, gently, thoroughly, and regularly at a dental office. That woman who got her teeth cleaned throughout her pregnancy is much less likely to have a preterm birth, to have an unhealthy baby, and to have a miscarriage.
Interesting.
That's interesting, right? I mean, nobody wants dead babies. So that started to get me to things like, okay, maybe, and you take a step back and you look at gum disease. What's happening with gum disease? When your gums just get inflamed, when they're red, when they bleed a little bit when you brush or floss, the gums are starting to get puffy. What does that mean? There's extra blood going into that area. But then why? What happens? Well, it turns out that the bacteria on our teeth, in our gums, by our roots, are actually trying to get into the gums. And once you start having loss of bone, once you start having gum disease, not just inflamed gums, once you start having bone loss, the bacteria are actually in our gums. They're in there. Well, they don't just stay there. They go through the rest of your body. And I think, if you have a healthy immune system, you're fine. But they keep going through. And so, God forbid, they can go towards the placenta. Turns out they go to other parts of our body too. And again, when I took a step back, started paying attention because babies, I realized there was a whole part of medical literature that was saying toxins from bacteria that live in places like our mouths when we have gum disease, or our guts when we have leaky bowel, when we have Crohn's disease, when we have an inflammatory bowel disease, they go into our brain. The toxins from those bacteria go into our brain and build up over time and contribute to Alzheimer's disease and contribute to dementia. And how much is the mouth versus the gut? There's no studies on that, but is it 1 out of 5? 20% here, 80% in your gut. Is it 5% from here, 95% from your gut? Who knows? But the point is that if we have an inflammatory diet, we're not taking care of ourselves, toxins literally go from our mouths and our gut into our brains and contribute to the decline of our brains, of our brain function. So you think about longevity, things start getting serious.
That's very interesting. Something that's very interesting you mentioned, like sometimes I hear it a lot from like lots of doctors in your industry. They say like, oh, it's very important to like floss your teeth, and especially like if, for example, people they use not the water one, but I forgot the proper name of it, but like it does make gum bleed. So are you saying that like when we do this, we actually put more bacteria in the stream of our blood, or?
That's a good question. That's a really good question. What I'm saying is not that. Although, so if your gums are bleeding when you floss or brush, the blood is pushing out. It's like, why do we bleed when we get cut? Like, why? Like, part of what it's doing is, God forbid you get cut on your arm, the blood is actually pushing anything that could be infectious out. So in a way, if you're going to be cut, bleeding is great because it pushes it out. Like with my kids, do I worry when they get a cut and they bleed a little bit? Like, no, it's fine. Okay, they'll be all right. I worry when they get cut and they don't bleed. So anyway, so the point is that sort of flossing, brushing, if you're doing something, as long as you're not sawing on your gums, just up and down, it's fine to bleed a little bit. It means, in a weird way, that we need to do it a little more. And in terms of flossing versus water pick, I am happy with anything. I think what we need to be doing is rinsing out. But then taking a step back and looking at our diet. If you're really bleeding when you brush or floss all the time, and not just 1 or 2 spots, but everywhere, there's something going on with your diet. And we know, from the medical literature now that there's real things that we can do. Omega-3 fatty acids are the most powerful anti-inflammatory we have. So fish oil or anything
Mm-hmm.
cod liver oil. In this country, gosh, people used to eat cod liver oil. That was like the medicine that you would have once a week, 7 times a week, whatever. Turns out there
Would
was a reason
you,
for that.
Sarah, would you recommend, like after like flossing, maybe like to use, I don't know, maybe like a tree oil or something just to kind of help to reduce the inflammation or like make the gum stronger and
Yeah.
better?
You know what the funniest thing is? So if you've been lazy for a while, focused on other things, let's say, let's not judge. If you've been focused on other things for a while, and then you're like, I'm gonna start doing this. I'm gonna start working on myself, and you start to floss, and there's kind of a lot of blood coming. You're like a little embarrassed, a little weirded out. Actually, a salt water rinse is the best thing you can do. Like a teaspoon of salt in a cup of water, warm it up a little, take a
Mm-hmm.
swig, save the rest for later, warm it up in the microwave or whatever you like, and swish with that for like 2 minutes twice a day. Your gums will stop being so inflamed, and the bacteria will literally get soaked out of your mouth.
Very, very interesting. Well, thank you so much, Jeremy, for like such a wonderful advice. I'm sure our listeners would really appreciate it.